Hello, I'm Sister Lisa Maurer, one of the Duluth Benedictines, here to share with you about Unit 7 of Governance Formation, the Ministry of Catholic Healthcare. There are 4 basic foundations of Catholic healthcare. First of all, we are entrusted with continuing Jesus' healing mission. Secondly, Catholic healthcare is based on Catholic social teaching. Through that, we get our mandate to take care for the dignity of all people, to take care of the common good, to respect all life, and to be good stewards. Catholic healthcare is also founded on sponsorship. The Benedictine health system gets their sponsorship through my religious community, the Duluth Benedictines. It is from our sisters that we get our vision, our values. We even get our name, Benedictine Health System. And lastly, Catholic healthcare is founded on the people who serve. Without the people working at the bedside, we could not do what we do in the special way that we do it. Here at BHS, we are so proud of our nurses and our aides and all the people working at our local communities and in our support centers to carry on this precious, precious mission. So you might wonder, what sets Catholic healthcare apart from other healthcare organizations? Well, first of all, it's the fact that we are in direct continuation of Jesus' healing mission. That mission is so important to articulate who we are and how we are called to be. Keeping that in mind, we anticipate and respond to the needs of the people that we are called to serve, especially in our local communities, and we do it in a way that, again, is founded in Catholic social teaching. We are called to be a witness to God's love in the world today, be the presence of God in our world today, and respond to that call of Christ to care for the sick and the needy above and beyond all else. Speaking of that call, it's really a vocation. It is a response to that special prompting to carry on Jesus' mission. We do our service in the name of the Church. It's definitely a unique call. Take, for instance, the fact that you are a board member, but you're not a board member just at a bank or some other organization. You are here within the Benedictine health system, a part of Catholic healthcare. It's like a call within a call. You could be doing this work anywhere, but you're doing it with us and for us. The same is true for the nurses and anyone who is an associate within the Benedictine health system. They're bringing their skills and their talents, but they're doing it within Catholic healthcare. That response of ours is so important. Yes, the call begins with God, but it is our response, it is our commitment to Catholic healthcare that brings the mission to life. The Benedictine health system also has a call. It's to provide quality care and service to aging adults, helping them to live fully and to live well, and meet the needs of our local communities. It's about practicing good business principles, about planning and visioning and motivating to ensure that our mission continues on into the future. The call of leadership is important. All leaders are called to use their gifts and talents for the common good. Within the Benedictine health system, we are called to be servant leaders. That means what we do in imitation of Christ, who is the ultimate servant leader, putting other people first. Leaders within the Benedictine health system are called to protect and promote our Catholic identity, to help us to live out our mission, our core values, and to ensure that this mission will continue into the future. Leadership within the Benedictine health system is also about empowering others. It's about seeing others as God sees them and helping them to be who and how God calls them to be. The Reverend Martin Marty says that the call that we have gives coherence and mission to Catholic healthcare. In other words, it's that call that unites us. It's living out our mission and values that brings us together and empowers us to do what God calls us to do. Thomas Merton says, for each one of us, there is only one thing necessary: to fulfill our own destiny according to God's will and be what God wants us to be. Those of us within the Benedictine health system believe God is calling us to live out this mission. Our mission within the Benedictine health system is to continue the healthcare ministry of our Benedictine sisters. Our mission in particular is to witness to God's love by providing compassionate, quality care with special concern for the underserved and those in need. In closing, I would like to leave you with a few questions for reflection and discussion. First of all, how did you become a part of Catholic healthcare? In other words, describe your call to being a part of BHS. Second of all, take time to reflect on what makes the Benedictine health system special. And lastly, What are you doing, or what could you be doing to promote and protect the Catholic identity, the mission and values of BHS? Thank you, and may God bless you as you continue your ministry with the Benedictine Health System.